we're going to show you how to wash your hands properly.
First, we start by turning on the water, getting some soap, and washing our hands. And that's it.
She forgot to take out her watch and to scrub her nails. So this is the way to do it. You get soap, scrub, and you also scrub your nails. That's all.
Okay, you both did it wrong. You're supposed to remove all of your jewelry and watches included. Then you come over here and you get the water to the right temperature, warm. And then you can get your hands wet up to your elbows. And then you can get some soap. And then you just start from your hands. Make sure you do the back, going all the way up to your elbows. Make it good laterally. And then you can have a red for your nails. And then you rinse all the way up to your fingertips. And in some cases, you can use things like this. This is to be able to scrub your arm and sterilize. This you use for underneath your nails. I believe you would go and you would use it under your nails like this to get any gunk out. Do this. Go and you get this. You get it wet, and then you just start going up to your elbow. And if you get anything in your nails and your fingers, and you go all the way up to your elbow. Go to the other side. You can discard this now. And then you just start rinsing again. Make sure you don't touch anything. And then you grab your paper towels and you start drying so you can stay sterile.
Today we'll be talking about the proper ways to wear personal protective equipment, also known as PPE, and a few simple steps. Now we're going to show you the correct way that PPE should be worn. So if you look over here to Zoe, she's got her face mask on correctly. She's got her garb on tight enough to fit her waist, gloves, and booties.
Excellent!
Now we're going to show you the incorrect way to wear your PPE. He's got his face mask where his hairnet should be. Not wearing the face mask and eating. The garb is not tied, and he only has on one booty. That's wrong.
This is a laminar flow hood.
And we are going to show you how to sterilize it.
So this is the equipment you're gonna need. You're gonna need 5 paper towels, alcohol, and gloves. Okay, so step 1, you wanna gather all your paper towels together. And then the next step will be pouring alcohol on them. I think that should be enough. And then the next step, you wanna sterilize your gloves. Okay, first we're going to start by grabbing one paper towel. Starting with the back, we're going to do one swipe. And repeating the same.
Go!
Next we're going to grab another paper towel and clean the top. Third step, we get another paper towel and clean the windows. The final step is to clean the bottom and the pole. Now that the laminar flow hood is clean, we can create sterile compounds.
Today we'll be discussing and demonstrating how to use a IDP bee bag as well as IV push medication, also known as the piggy bag.
Okay, today I'm going to be showing you all the materials that you'll be needing to reconstitute for an IV piggyback medication. We're going to start off with a bag itself. An IV piggyback is usually administered in a 50 ml to 100 ml bag. For example, like an antibiotic that is administered intermittently. You're gonna need your powder and then your medication to reconstitute with. Oftentimes it comes in the form like this. You're also gonna be needing needles, syringes, alcohol prep pads, a pair of gloves, and a sharps container. Okay, now I'm gonna be showing you how to properly reconstitute the medications. You're gonna start off with your syringe. We're gonna go ahead and remove the syringe and place the needle on top. We're gonna leave the needle cap on for the time being to prevent any kind of bacteria touching that needle that's gonna go into our medication. We are then gonna take an alcohol prep pad to prep the top of our medication to make sure that it is sterile. So you're gonna go ahead and you're gonna take your syringe and you're gonna pull back the prescribed amount, which is 1.5 mLs. From there, you're gonna go ahead and remove the cap to your needle and go ahead and inject that into your solution and press that air in there. From there, you're gonna go ahead and make sure you have no air bubbles and withdraw the 1.5 milliliter solution. And then we're going to inject that into our powder. Replace the lid. Dispose in a sharps container. Replace the cap and swish in a 360 motion until all of the powder is dissolved. And that's how you reconstitute a medication to then be injected into an IV piggyback.
Now that we properly prepared our IV PB, I will now show you guys how to properly do an IV push. So these are the items that you would need to start an IV push. You would need the medication that the doctor prescribed, alcohol pad wipes, you would need the disposable needle, and a syringe. And with following the same instructions as we did when we reconstituted the medication, we would do the same thing here. So you would get the acquired dosage from the doctor, which is 1.5. You put it into the vial. You'll push down, you'll feel some pressure, and you'll make sure that the needle bevel is in the medicine. You'll pull back. You get about 1.5, making sure that there's no air bubbles. And to ensure that, sometimes we like to tap. And now that you got your medicine in the syringe, you would safely put the cap back on the needle. Once that's done, you would now get the piggyback ready to do the push. The first step in doing that is to make sure that we use the roller clamp and stop it by rolling it down. Once that is off, we would go and start to sterilize our Y site. Now that we stop the roller clamp, it prevents any medicine going into the Y site, which goes straight to the patient. So to sterilize, we will get an alcohol pad and make sure to rub the Y site. Once you do that, you safely take the cap off the needle and inject the medicine into the Y site. Once that is done, you would put the lid back onto the needle, use a sharps container, and turn the roller clamp back on so the medication could be intermittently diffused.
Okay, and that's how you reconstitute and prepare for an IV piggyback and an IV push.